Have you ever wondered about the implications of the ongoing doctors' strike in Kenya? In the heart of East Africa, Kenya is facing an unprecedented healthcare crisis. A nationwide strike by doctors demanding better pay and working conditions is causing significant upheaval. The government has taken a firm stance, refusing to engage in negotiations until the strike is suspended. Yet, the doctors remain steadfast, insisting on the full implementation of their 2017 Collective Bargaining Agreement, or CBA, before they return to work. This agreement, if implemented, would see salary ranges increase significantly, with interns earning a minimum of 212,000 shillings and consultants earning up to 814,000 shillings. The agreement also includes promotion schemes and comprehensive medical cover for doctors. This standoff between the government and the medical fraternity has led to a stalemate that is affecting the nation's healthcare system. But what led to this strike, and what are the demands of these striking doctors? To understand the current crisis, we need to delve into the reasons behind this strike. The root cause of the recent doctors' strike in Kenya lies in a conflict of interests and unfulfilled promises. The doctors are demanding better pay and improved working conditions, a plea that dates back to a previous strike in 2017. Back then, an agreement was reached, a collective bargaining agreement, or CBA, which promised a salary range from 212,000 shillings for interns to 814,000 for consultants, along with promotion schemes and a comprehensive medical cover. Unfortunately, these promises have not been fully implemented, causing a resurgence of dissatisfaction among doctors. Their plea for better remuneration and working conditions has reignited, leading to a nationwide strike that has now entered its second week. The government, on the other hand, cites financial constraints as the primary reason for not meeting the doctors' demands. Government spokesman Isaac Mwora stated that the demand for intern doctors to be paid 206,000 shillings is unsustainable, drawing comparisons with other professions such as lawyers. An additional layer of complexity to this issue is the government's stance on negotiations. The government has made it clear that it will not engage in discussions with the striking doctors until they suspend the ongoing strike. This firm stance has only fueled the determination of the doctors, who insist on the full implementation of their 2017 CBA and the initiation of talks for a new one before returning to work. Despite the government's plea for understanding and acceptance of the offer from the Salaries and Remuneration Commission, the Doctors' Union has continued with protests and has petitioned Parliament for intervention. This standoff has led to the layoff of 100 doctors at Kenyatta University Referral Hospital and their replacement with new hires, further escalating the tension. Now that we understand the causes, let's explore the effects of this strike on the healthcare system and the public. The strike is not without its consequences, affecting both the healthcare system and the public. The ripple effects of the doctors' strike have been felt far and wide. One of the most immediate impacts was the layoff of 100 doctors at Kenyatta University Referral Hospital. This decision was not taken lightly, but under the pressure of the strike, the hospital administration felt compelled to hire new doctors to fill the void left by those who had joined the strike. As you can imagine, this sudden change has had a drastic impact on the healthcare services available to the public. The hiring of new doctors, many of them fresh graduates, has raised concerns about the quality of care patients receive. This situation is particularly challenging for those in critical conditions who require experienced medical attention. Furthermore, the strike has also heightened health risks across the nation. With fewer doctors available, many patients are facing longer waiting times, delayed surgeries, and postponed treatments. This situation is particularly dire for those in rural areas where access to healthcare was already limited. The strike has also put a significant strain on the remaining healthcare workers. Nurses, clinical officers, and other medical professionals are now shouldering a heavier workload, which could potentially lead to burnout and further compromise the quality of healthcare services. In addition, the strike has also created a sense of uncertainty and anxiety among the public. With doctors demanding better pay and working conditions, and the government citing financial constraints, Many are left wondering when and how this standoff will be resolved. The effects of this strike are far-reaching, but what can we do about it? While the situation seems dire, there is something you can do. You can arm yourself with knowledge, because when you know better, you can do better. And the best way to stay abreast of this critical issue is by tuning into the Wiz Warekwa YouTube channel. Here you'll find regular updates, in-depth analyses, and engaging discussions that will help you understand the ins and outs of this healthcare crisis. Knowledge is power. Stay informed, stay powerful. Head over to Wiz Warekwa on YouTube for more updates on this pressing issue.